Welcome back. We have Dr. Preety Desai, laser implant periodontal specialist. Thanks for being here, Dr. Desai.
Thank you, Tanya. Happy New Year.
Happy New Year to you too. I know, I've been saying that all week. I just haven't seen everybody since last year. So today we're talking, speaking of New Year's, resolutions. And a big one is trying to quit smoking.
That's right.
It's a hard one though, but it's one that really can affect your overall health, especially gum health, right?
Very much so, yeah. Smokers are at a very high risk of course, all the other negative things in lungs and heart, but also smokers lose their teeth 5 to 6 times faster.
Wow. And
also have 5 to 6 times worse periodontal disease to cause loose teeth and poor aesthetics, etc.
Wow. What happens in, you know, if you're, do you have to be smoking for an extended period of time, over several years for it to really affect you, or can it be a short period of time?
There are short-term and long-term negative effects. The short-term, of course, are the bad breath and the dry mouth, etc. The long-term are bone loss and lack of bleeding or lack of nice blood circulation to all body parts, including the mouth. And so smokers actually don't have bleeding gums when your hygienist asks you, are your gums bleeding? Smokers don't experience that.
Oh, really?
So over time, their bones get more porous, their vessels are squishing up, so their heart gets less blood circulation, their lungs, your brain even. And all the negative toxins in a cigarette, such as cyanide, polonium, there's radioactive material. Cyanide, of course, is rat poison. Butane, which is lighter fluid.
Wow.
Increases the temperature.
when you break it down like that, it's not
it's not
doesn't sound very good.
Yeah.
So those sorts of things. So it's not just tobacco we're talking about.
No, in fact, tobacco is probably one of the least addictive parts of the cigarette. It's the ammonia, which allows the nicotine vapor to enter your lungs faster, cross the blood-brain barrier, so it affects your cognitive function, and it allows that dopamine release, which gives you that smoker's high. Right. So that's why when you start to quit, you kind of go for another comfort thing of eating or drinking, you know, as a side effect, which makes quitting very difficult.
You brought a few little things here. This is, I guess, mostly the gum, right? Ecigarettes and...
Yeah, Ecigarettes is the company, of course, but there's the patch, there's the inhaler, there's a lozenge as well. And interestingly enough, the gum is one of the most successful quit smoking tools that a person can buy into.
Better than the patch?
Almost better than the patch. And actually, Philip Morris and the other companies asked for the gum to be taken off the market because it was more successful.
Wow.
And that's a little known fact there. So if you're gonna, you know, invest in a one-time deal, the gum will be a good option for you.
Is this the e-cigarette, or what is this one?
This is the inhaler.
Inhaler, okay. Yeah,
and the e-cigarette is approved in Canada, in the States, but not in Canada yet. What happens is that the nicotine vapor is not past Health Canada guidelines yet. So I'm not sure what's going to happen with
Could that still affect the health of your gums?
It can, but again, if you were a pack-a-day smoker, which is 20 cigarettes, if you have the effectiveness of less than 10 cigarettes a day, you actually see physiologic changes in your mouth, your body, your heart. So even if you can't go cold turkey, less than half a pack a day still makes a difference.
It does,
Yeah, and immediately, within 72 hours, you see a change.
Do you see a lot of this in your practice?
I do. Unfortunately, the majority, I would say over 60% of periodontal patients are smokers. Wow. And smokers in general will die 50% of the time of a smoking-related illness, which is unfortunate.
Can the damage be repaired though, Dr. Desai? I mean, obviously you do what you can to help, but you know, the bone loss and everything, can it only be repaired to a certain extent, or?
That's a great question, because there have been just recent studies done to follow former smokers over 5, 10, and 15 years. And by 10 years, everybody shows as if they were a non-smoker. So yes, it is reversible. Everyone varies according to the severity, their own immune system, their own genetics, and how they can quickly repair themselves. You know, if you were, 1 or 2 puff a day, you can quickly repair things. But if you're a pack a day or more, then it takes more time to do that.
Well, I think that's all the information everyone needs to know to quit smoking for 2014, right?
Exactly.
Thanks for being here, Dr. Desai. That was great.
you.
Dr. Preety Desai, there's how to contact her, and of course the website as well. And hopefully you see less and less patients who are smoking and having the effects
Everyone
of it.
is more aware now, so
Yeah.
that's all good.
Absolutely. Great. Thank you so much. We'll be right back. Stay with us here on Midday.